Stroke warning signs 24 hours before it happens. Don't ignore these symptoms. Before you skip this video, I need you to hear one sentence that could genuinely save your life. By the time you finish listening to the next 5 seconds, somewhere in the world, another person will suffer a stroke. Another person will lose their speech. Another person will lose movement forever. Another family will receive a phone call they never expected. And the terrifying part? In many cases, the brain warned them beforehand. So before we begin, subscribe to the channel, press like, and write in the comments, "I protect my brain." That small action helps this information reach more people who may desperately need it. My name is Dr. David, and today I'm going to explain the hidden warning signs of stroke that millions of people ignore until it's too late. Not with fear, not with complicated medical language, but in plain English anyone can understand. Because stroke is not always random. Most of the time, it is the final stage of damage that has been silently building inside the blood vessels for years. Your arteries slowly narrow, plaque slowly forms, blood flow slowly weakens, tiny clots slowly develop, and then one day, the brain suddenly loses oxygen. Most people think stroke happens like lightning. You're fine, then suddenly you collapse. But medically, that's usually not true. The body often whispers before it screams. And the scary part is this. Many people experience warning signs hours, days, or weeks before a devastating stroke happens. Doctors call these warning episodes transient ischemic attacks, or TIAs, mini-strokes. Temporary, short, easy to ignore, but medically, they are a fire alarm. In many patients, the major stroke happens within the next 72 hours after these warning episodes. 3 days. That's the window where permanent brain damage may still be prevented. And tonight, I want to show you the warning signs your brain may already be sending. The first warning sign is temporary blindness in one eye. Imagine waking up in the morning, walking toward the kitchen, and suddenly one eye goes dark. Not both eyes, just one. Maybe it feels like a gray curtain sliding over your vision, maybe like fog, maybe like someone smeared mud across your eye. Then after 20 seconds or 1 minute, your vision suddenly returns. Most people ignore it. They blame stress, fatigue, low blood pressure, or too much screen time. But neurologists hear something completely different. They hear danger, because this often means a tiny clot briefly blocked blood flow to the retina. And here's what makes this so dangerous. The artery feeding your eye comes directly from the same carotid artery that feeds your brain. That tiny clot may have simply taken the less dangerous path first. The next clot may travel slightly farther and block part of the brain instead. That's when speech disappears, that's when paralysis begins, that's when lives change permanently. Doctors even have a special term for this symptom, amaurosis fugax, temporary blindness. And in medicine, this symptom is treated like a major warning siren. If you have ever experienced sudden vision loss in one eye, even briefly, do not dismiss it as normal aging. The second warning sign is sudden numbness or tingling on one side of the body. This one gets ignored constantly. A person suddenly feels pins and needles in one hand, one arm, one side of the face, or one leg. Maybe the arm suddenly feels heavy, rubbery, disconnected, and then 10 minutes later, everything feels normal again. That temporary recovery tricks people into believing nothing serious happened. But the truth is frightening. Stroke symptoms are usually one-sided because each side of the brain controls the opposite side of the body. So when blood flow suddenly drops in one area of the brain, the body map briefly shuts down. The numbness is not in the arm. The danger is in the brain. Now yes, sleeping on a nerve can cause temporary tingling, but nerve compression has a reason, a body position, a trigger. Stroke-related numbness often appears suddenly without explanation. You're talking normally, walking normally, sitting normally, then suddenly something feels wrong. And if it affects only one side of the body, that should never be ignored. The third warning sign is sudden dizziness or loss of coordination, what many people describe as a drunk walk. You suddenly drift sideways, your foot lands wrong, you lose balance for no reason, you grab the wall, the room suddenly spins violently, and almost everyone says the same thing. I'm probably tired. I stood up too fast. Or it must be my blood pressure. But sometimes it's the cerebellum, the balance center of the brain. The cerebellum constantly calculates posture, movement, and coordination. When blood flow briefly drops there, the body loses precision. And because these episodes may last only minutes, people brush them off until the real stroke arrives. Here's something important many people misunderstand. Not all dizziness comes from the inner ear. Inner ear dizziness usually has triggers: turning the head quickly, rolling over in bed, or changing positions. But sudden intense dizziness without a clear trigger, especially combined with difficulty walking, should always be taken seriously because strokes affecting the back of the brain are often missed early, and those strokes can become catastrophic. The fourth warning sign is sudden speech problems. Everyone forgets words sometimes. That's normal. You forget someone's name, you walk into a room and forget why you entered. That is not what neurologists worry about. What worries them is sudden language breakdown. A person suddenly cannot form words properly. Speech becomes slurred. Sentences stop making sense. Sometimes they know exactly what they want to say, but the words simply won't come out. Other times they speak fluently, but the words are complete nonsense. And what's terrifying is this: the symptom may disappear after only 5 minutes. Then the person continues with their day like nothing happened. But those few minutes may have been the brain starving for oxygen. Inside the left side of the brain are language centers responsible for speech and understanding. When blood flow drops there, language collapses. If your speech suddenly changes, if words stop making sense, if someone tells you, "You're talking strangely," do not ignore it, even if it resolves quickly, because transient speech problems are one of the clearest warning signs of stroke medicine knows. Now there's another warning sign most people never expect. It involves autoimmune conditions and unusual headaches, specifically vitiligo, the white patches of skin where pigment disappears. Vitiligo itself does not mean someone will have a stroke, but it can reveal something important: the immune system has become dysregulated. And when inflammation begins damaging the body, blood vessels may suffer too. Inside every artery is a thin protective lining called the endothelium. Think of it like a smooth, non-stick coating. Healthy blood vessels allow blood to glide smoothly, but inflammation damages that surface. Once damaged, cholesterol sticks more easily, plaque forms faster, clots develop more easily. So if unusual headaches suddenly appear alongside autoimmune issues, doctors take that seriously, especially when those headaches feel different from your normal pattern. Now let's talk about one of the biggest myths in modern health. My cholesterol is normal, so I'm safe. No. Stroke risk is not only about cholesterol. It's also about the health of the blood vessels themselves. And one of the biggest destroyers of those vessels is high blood sugar, even before diabetes officially appears. Many people think prediabetes is harmless. It isn't. Chronically elevated glucose silently damages the lining of arteries for years before symptoms appear. The vessels become rough, inflamed, rigid, and once blood vessels lose flexibility, plaque begins sticking more easily. That process can continue quietly for years while someone feels completely healthy, which means a person may believe everything is fine while stroke risk steadily increases in the background. Now we need to talk honestly about smoking, because many smokers still believe, "My grandfather smoked his whole life and lived to 90. But medicine does not work through lucky exceptions. It works through patterns, and the pattern is clear. Smoking dramatically increases stroke risk. Every cigarette chemically attacks blood vessels. The blood becomes thicker, stickier, more likely to clot. The vessel walls become inflamed, oxygen delivery falls, circulation worsens. Over time, smoking ages the arteries everywhere: the brain, the heart, the kidneys, and the eyes. In stroke medicine, we often say, "Your arteries remember every cigarette." Now here's something else that surprises families. Many strokes happen during sleep. A person goes to bed feeling normal and wakes up unable to move an arm or speak clearly. Why? Because blood pressure naturally drops at night. Normally that's healthy, but if a brain artery is already critically narrowed, that nighttime drop may reduce blood flow enough to completely block circulation, especially if a clot forms during sleep. That's why untreated high blood pressure is so dangerous over time. It silently damages arteries year after year. Now let me tell you something many younger adults don't want to hear. Stroke is not only an old person problem anymore. Doctors increasingly see strokes in people in their 30s and 40s, sometimes younger. Poor sleep, smoking, stress, obesity, prediabetes, and high blood pressure age blood vessels faster than most people realize. And one hidden cause of stroke is especially dangerous because many people don't even know they have it: atrial fibrillation, AFib. This is an abnormal heart rhythm where the upper chambers of the heart stop beating normally and begin quivering chaotically. When blood swirls instead of flowing smoothly, clots form easily, and those clots can shoot directly from the heart into the brain. These strokes are often severe. The terrifying part? Some people feel almost no symptoms, maybe occasional fluttering, skipped beats, brief palpitations, or nothing at all. That's why doctors use something called Holter monitoring, a portable ECG worn for 24 hours or longer, because dangerous rhythm problems can appear briefly and disappear before a short clinic ECG ever detects them. Now here's the most important question. What should someone do if they experience one of these warning signs? First, do not panic, but never ignore it. The first 72 hours after warning symptoms are critical. That is when many major strokes happen. And one mistake many people make is staying completely alone afterward. If a more serious episode suddenly happens, who will call for help? Tell someone you trust, a family member, a friend, or a neighbor. And another important rule: do not drive yourself. Temporary vision loss or weakness can become deadly behind the wheel. And never start blood thinners based on internet advice alone. This is extremely important. There are two major types of stroke, one caused by blockage and one caused by bleeding. Blood thinners may help one type but can make the other dramatically worse. Only brain imaging in a hospital can safely determine the difference. Now, if you've experienced any of these warning signs, there are 3 medical evaluations worth discussing with your doctor. The first is a carotid duplex ultrasound. This test examines the major neck arteries supplying blood to the brain. It can detect dangerous narrowing and plaque buildup before a catastrophic stroke occurs. The second is an HbA1c blood test. This shows average blood sugar over roughly 3 months and helps detect prediabetes and silent vascular damage. And the third is Holter ECG monitoring, a portable heart monitor used to detect hidden rhythm problems like AFib. Finding these problems early can literally prevent a future stroke. And that's the real message of this video. Stroke is often predictable. The body usually warns us first. Temporary blindness, one-sided numbness, sudden dizziness, loss of coordination, speech problems, unusual headaches. These are not symptoms to wait and see. These are warning signs the brain may already be struggling. So after this video, I want you to do something simple. Write down your risk factors honestly: high blood pressure, smoking, diabetes, prediabetes, stress, poor sleep, heart rhythm problems, not to scare yourself, but to become aware, because awareness changes behavior and behavior changes outcomes. If this video helped you understand stroke in a clearer way, subscribe to the channel, press like, and share this with someone over 50. One share may help someone recognize a warning sign before it's too late. And before you leave, write in the comments, "Brain health matters." I read every comment. Take care of your brain, protect your blood vessels, and I'll see you in the next video.